Hello, and thank you for joining us for this session of the Patient Engagement Lunchtime Learning Series for the George and Fahey Center for Healthcare Innovation. This next 15-minute session will be describing the Preparing for Research by Engaging Patient and Public Partners, or PREPP award, the eligibility criteria, what makes a strong application, and some useful resources from the Center for Healthcare Innovation. I'm Trish Roach. I'm a knowledge broker at CHI. And so this award is specific for Manitobans, but a lot of the information I'll be sharing in this video will be applicable and useful if you're applying for grants from other funders that involve any kind of patient engagement component. So the PREPP award is for engaging in the early stages of health research in the research design and grant development phase. We heard in a 2015 survey of Manitoba researchers that there was a gap in patient engagement. So a lack of funds of engagement prior to actually receiving grant funding for a project was seen as a barrier to doing meaningful engagement, especially trying to do it from the very early planning stages. In 2017, we launched the PREPP award to address this gap. To date, we have funded 34 projects, many of which have gone on to win larger grants, such as the CIHR project grant, and they continue to engage with patient and public partners throughout the research process. Many have told us that the experience has been very eye-opening in getting a better understanding of the perspective, needs, and experiences of people with lived experience of a health condition or health conditions, and recognizing how their involvement in the research and research decision-making can actually improve the research, make it more relevant, make it more useful, and make it more widely accepted by the people who are ultimately impacted by the work. This year, we have 5 awards available of $4,000 each to Manitoba researchers, students, and community organizations to support the involvement of patients, families, caregivers, communities, and members of the public in decision-making about research design and grant development. The Manitoba Primary and Integrated Healthcare Innovation Network, or MPN, is a gold sponsor for one successful award that's focused on research in primary or integrated healthcare. And the Children's Hospital Research Institute of Manitoba, or CRIM, is another gold sponsor, and their criteria is for an award focused on research related to child health. We're launching September 9th with a due date of November 9th at 5 p.m. Central. In terms of eligibility, the award is open to Manitoba researchers, students, and community organizations who are planning a health research project or program. And I will provide a definition of health research here. It is rather broad, but it states that this is work that increases our knowledge of health, disease, and or health services and aims to apply that knowledge to help people lead healthier lives. The goal of the research or the application should be to engage with people with lived experience in making decisions about the research project or program. And this needs to be done before project funding has been received. So you can have other projects funded, your program can be funded already, you can have scholarships if you're a student, but the project you're planning to engage about must have not yet received funding and be in the planning stage. We do encourage previously unsuccessful applicants to submit a revised application based on reviewer feedback. If your application is chosen for funding, the $4,000 will be available for 18 months. Usually it's a year, but we've extended this knowing that things take even longer during this pandemic situation. You'll receive a free virtual 1-hour consult with our patient engagement team to help refine your engagement plan and go over any reviewer feedback or issues that may have arisen. We do offer fee-based services. This includes things like facilitation of groups, planning, recruitment, so we can discuss those in the consult. At any time, if you are looking for these services outside of the PREPP award, we do offer free 1-hour consults. As an award recipient, we expect your participation as an attendee of the Lunchtime Learning Series and potentially a speaker. We ask also that you complete an evaluation for the award, talking about what you did, how it impacted the research, as well as those involved. Note that if your application is not successful, we do provide reviewer feedback so you can improve your application for the next funding call. In terms of assessing your application, our review team includes researchers, patient engagement professionals, and patient and public partners. Because of this, we expect that your application will be written in plain and accessible language, that is no medical jargon, avoiding acronyms, and aiming for a grade 6 reading level. There are 6 required sections. Letters of support are entirely optional. Applications are assessed based on these 5 main criteria. And each of these criteria is given a score out of 10 for a max total of 50 points. Reviewers, after they've given these scores, will then provide us with one of 3 final ratings. The first of which is just outright recommendation to fund your application. If you've done a great job, you followed all these recommendations, you have a strong application, you'll probably fit into this category. They may also, secondly, recommend to fund subject to certain conditions. So this might be something like including more patient partners, different populations of patients and members of the public, and clarifying which decisions they'd be involved with, things like that. And that would be addressed in the 1-hour consult should your application go through as successful. The third recommendation would be that the application is not suitable for funding at this stage. Generally, this happens if there's a lack of fundamental understanding of the principles of patient engagement. So we do strongly suggest employing the resources listed throughout and at the end of this talk when preparing your application. The application form itself is available on our website, chimb.ca. It has 6 required sections with an optional section for letters of support. These won't make or break your application. They're totally optional. And I'll talk a little bit more about them at the end. We do ask that you limit your application to 6 pages. That's excluding references, so those can be in excess of 6 pages. But this way we can ensure that reviewers are able to provide a fair and thorough review for all applicants. You can totally choose which sections get more pages than others, but altogether 6 pages or less for the main part of your application. So these 6 sections. The letters of support, optional, can be in excess of those 6 pages. Okay, so what makes a strong application? Based on the criteria for assessing your application, I'll give some key points that really strong applications have shown for each of the different application form sections. For section 1, project information, this is where you would tell us about your research is about, why you're planning to engage people with lived experience. A strong application for this section will incorporate most or all the elements of patient-oriented research that Carolyn mentioned in the Intro to Patient Engagement talk. A strong application's research topic will be driven primarily by the priorities of people and communities it plans to engage with. Some of our strongest applications have actually engaged around research topics that were in fact selected by the communities themselves. Here you will clearly state the purpose of engaging with specific people or communities and demonstrate the relevance of engagement to the research topic. And you will benefit from having at least an idea of which grants, funding calls, or agencies you want to ask to fund this project. It's okay to be flexible here, especially if you're shaping the research alongside patient and public partners, but you do need to demonstrate that you have considered your plans for moving forward and how the project will be funded. In terms of engagement activities, here we'd like you to give us a breakdown of what kind of activities you plan to do for engagement, decision-making, consensus building. Again, you can and should be flexible based on patient partner input, but have an idea of the direction you want to go. Tell us some details, how often you think you'll meet, for how long, how many partners you're planning on engaging with, things like that. Make sure that the level of engagement you're proposing, that is consultation, collaboration, or patient and public directed, is in line with the methods you are proposing. For example, something like a survey or questionnaire does not meet the collaboration level of engagement. Our methods guide, which I've linked to here for engagement activities, that link is to this guide. It's found also on our webpage under resources. It'll be incredibly useful for this section. It outlines the different participatory methods that you might want to use in patient engagement and at which level they are most appropriate. We do know that things will more than likely change based on patient and public partner input, so it's okay if your plans aren't 100% solid. They really shouldn't be. Show us you're flexible and adaptable, particularly in your methods for decision making. And a strong application will also incorporate plans for addressing issues around safety through the use of trauma-informed methods and discussions of what makes people feel safe. So this means talking to patient and public partners ahead of engagement activities to find out what is required for them to feel safe in a space. You don't want to unintentionally cause harm or re-traumatization through your activities. For example, this online virtual space that we're all using may not be the best way for everyone to engage, considering issues like having an actual safe, quiet, private space in the home to conduct activities. Again, it's okay if you haven't already done this step and talked to patient partners, but make sure that you are considering it and you show us that. Also determine if there may be ways to ensure that all partners are able to meaningfully contribute by including a variety of methods for providing input. So that could be one-on-one video conferencing, text, phone, email, or even snail mail. Strong application will also consider the potential for long-term engagement and the building of strong, trusting, long-term collaborations in research. In this section about patient and public partners, we want you to describe the individuals, communities, and or populations you plan to engage with. Remember that partners are different from participants. Participants are people who you're collecting data about and reporting on in a publication or presentation. However, we do encourage publishing about patient engagement experiences. There's not a lot of information out there. More and more is being published in the literature, but this could be a real opportunity for you to work with a patient or public partner as a co-author and share the experiences of engagement. But in this situation, we would expect people involved are both partners in making decisions about the research, as well as participants in sharing data about the patient engagement experiences. A strong application will have plans to complete an external assessment of partners' readiness to engage. And I've linked to the appropriate blog on our Knowledge Nug blog page in the Patient Engagement 101 series that talks about internal and external assessment. Demonstrate to us in this section how partners and their communities will benefit from their involvement in your work, and explicitly consider specific needs and barriers to engagement. Things like childcare, internet access, having materials printed and delivered to people, and any special training like TCPS2 core, etc. In terms of the research team, describe to us who is on the research team, whether or not they have had previous experience in patient engagement, not necessary, but let us know if there is, and what each person on the research team's priorities are for the project and their specific roles in engagement. So is the principal investigator going to be leading discussion groups with patient and public partners, or will a research assistant be taking on this role? Tell us about any training your team plans to do to improve their understanding of the principles of meaningful engagement. So this could be attending Lunchtime Learning Series, courses offered by other institutions, reviewing our entire blog series, those kind of things. I've also linked here again to the internal assessment. This is for your own team, and it's key to understanding your team's capacity for meaningful engagement, where you'll be able to be flexible about the research and where you may not be able to be so flexible. So knowing this ahead of time and sharing it in your application. The impact of engagement is where you'll discuss how patient and public partner involvement will actually impact the research. Will their input simply be considered for making research decisions? Or will they play a more active role in planning the research? Who ultimately holds the decision-making power for which decisions? Which specific decisions will they be involved in making, and how will their input actually be used? A strong application here will have considered the processes of consensus or decision-making, and will also have plans to involve partners in shaping these methods. If there are plans also to provide partners with a means to provide feedback to the team about engagement, this can be described in this section. And make sure you are discussing how you're going to close the feedback loop with partners, not leaving things open-ended, and making sure you're following up about how their contributions actually impacted the research, your work, and your program, and even the people involved. Often partners and all of us have, the really rich, in-depth, specific experience, but also broader perspectives and issues, concerns, needs, and values that might not be able to be incorporated in the research. So as you're able to, discuss here how these perspectives will be respected and valued, and if there's any way for you to help patient and public partners share those perspectives in a way that is meaningful and contributes to health research in general. Kind of the more technical side of things, the award budget. A strong application will dedicate most, if not all of its budget towards patient and public partner involvement, things like compensation, training, providing equipment, things like a tablet or a webcam if needed, short-term internet access, or buying a team Zoom subscription for meetings. It should go without saying, be sensitive to the current context. Think about what is and isn't a relevant expense right now, and what's feasible. We would strongly recommend you at least review our Budget Builder Excel tool, which I've linked to here, to ensure you have considered all relevant expenses for your engagement plan. Indicate here any additional supports you're receiving. These aren't required for a strong application, but if you have in-kind or other financial support that you might be receiving for engagement, let us know. A strong application will not include expenses that aren't directly related to engagement, such as publication fees. Those just don't fit the criteria for this award. You can, though, include expenses related to a research assistant who's going to help with organizing engagement and providing administrative support to partners, things like that. I didn't make a slide for the optional letters of support, but these could include letters indicating existing relationships with community organizations, other funders, or patient and public partners. Totally optional, and like I said, will not make or break your application. In terms of resources, I've kind of collected them all into a list here. The application form itself and information about previous winners can be found on our website on the PREPPP page. Our resources page includes that budgeting tool, Excel, that I mentioned, and the guide for selecting participatory methods based on the different levels of engagement. We've recorded our previous lunchtime learning sessions. You can view these on our YouTube. I've created a bit.ly link for you here. And the internal and external assessment and other patient engagement related blogs are on Knowledge Nudge. We do have a PE 101 series that I highly encourage you to take a look at when building your application. And we have a couple of articles that go a little more into depth about the theory and the fundamentals behind meaningful, inclusive, and safe engagement. The first is the paper published about why we need a trauma-informed intersectional approach for patient and public engagement. This includes some critical reflexive practice questions for you and your team to do to think about who maybe is not being included in your patient engagement plans, who has different access, who is affected by this work. The second paper, most recently published this year, is about the Valuing All Voices framework. This is a guiding framework for meaningful patient and public engagement in health research, co-developed with people whose voices are often less heard in health research. And we'll be sharing a bit more about this in our session on October 14th, 2020. The Lunchtime Learning will share the Valuing All Voices framework and how that came to be and what it involves. So there's a plug for that. And if you have any questions for us, you can contact us at chipartners@umanitoba.ca.